By the way, just yesterday, we told you President Trump has unveiled a plan to lower prescription drug costs through an executive order. Another, by the way, billions of dollars of those costs are due to the nation's spending on GLP-1 weight loss drugs that have transformed America's waistline, brought it in considerably. In a new book, Diet, Drugs, and Dopamine, the New Science of Achieving a Healthy Weight, former FDA Commissioner David A. Kessler examines the role of these new medications in the country's fight against obesity. Also joining us, a familiar face, our chief medical correspondent, Dr. Jon LaPook, who is a enterologist by your 25th anniversary here at CBS. I'll get that right. Good morning to both of you, Doctor and Doctor. I want to start with you, Dr. Kessler, because in addition to writing this book, you've been on your own journey with these drugs. How did you get on them, and how did you get off of them, which is a big question?
You know, I had the privilege of co-leading Operation Warp Speed. It was an intense period of time, 676 million vaccines. I didn't leave my seat in front of the computer working 18 hours a day. I turned around and found that I was exactly
bigger than you thought.
I was 40, 50 pounds heavier.
Wow.
I started losing weight the traditional way with diet. It was slow. I actually ended up having a kidney stone, ended up in an endocrinologist's office, and he said, "Do you want to try the new GLP-1 drugs?" I mean, I was studying them. I said, sure.
Yeah.
But it's a real journey. I mean, you can reclaim your health, but there are no such things as miracle pills.
Okay, so why do you say that? What was it like? What were the non-miracle parts, and then how did you get off of it?
How these drugs work, I mean, they take you to the edge of nausea. I mean, food just stays in your stomach longer. You're the gastroenterologist, and when food stays in your stomach longer, you're not going to want to put more food in your stomach. So it gives you, your brain gets reset. Because I look at food, I don't want to feel ill. So your brain's really conditioning itself.
Wow.
Right? So there's this opportunity, right, to change how you eat. But it's only one tool, right? This is not, take this medicine and you're going to become thin. This is a hard journey, but this has an extraordinary opportunity to change the health and the health of our country.
And that's what's going on in my own practice right now, which, of course, I'm an internist and gastroenterologist. I have people on these medications. And how do they get off the medication? Because, in the trials, which have not been long-term, right? We don't really know the long-term effects of these things. If you stop the medication, you regain the weight. So where are you in that journey? Are you on the medicine? Since you've brought it up yourself, I feel we can ask. Are you on them now? Are you off them?
There is no end game. FDA allowed these medicines out without a long-term strategy. The premise of the drug companies, you can imagine what they want. They want you to be on this for life.
Right.
And you're right. If you go off it, right, you're going to gain back the weight, right? So what we have to do, the most important thing is you have to be under good care.
Right.
Right? You have to have a doc. You have to have a nutritionist, a dietitian. Not everyone, has can afford that, and that really concerns me. But we got to do this under good care. But again, this visceral adiposity, I'm going to call it the belly fat, right?
Our audience, if you say visceral, but the belly fat.
But that's metabolically active.
It's visceral.
It is metabolically active. It is causal in cardiac disease, in kidney disease. And we can transform our health. We all knew weight wasn't good for us, but we didn't understand it really was at the heart of these diseases.
Dr. Kessler, every weight loss solution claims to, tell you that you can keep it off. So how can people maintain a healthy weight if they get off of these drugs? Are they destined to regain it, or are there things, if you're working with exercise, diet, perhaps mental health, like you've written in your book, that can help you keep it off?
The drugs will help reset your brain, but after a while, if you go off it, that's going to fade. So you're going to have other tools. You're going to have to learn to eat better. You're going to have physical activity, behavioral changes, and these drugs. And we're going to have more data. Companies are going to have to do a better job of getting data of how you can get off this drug safely. Can you go back on safely? FDA is going to have to require that data. but we have to put it together. That's why I wrote the book.
You know, there are these governors on cars where you can step on the pedal, but it will not go above a certain miles per hour. Is it the same thing with weight? If you start to gain at a certain level and you see, okay, I'm now up to this weight, I'm going back on the medication, even if I'm off it right now. I'm going to be on it for a little while to get back down and then try to get off again.
Now, that's how I use it.
Okay.
But that's no way to do this. I mean, we're just running a national experiment because we don't have the data with these drugs out there, and we're going to have to require it.
But you're talking about being under good care. You know what? We all know you can get these medications online with very little interaction with a healthcare professional.
And that concerns me.
Right.
Right? I mean, these are breakthrough drugs, right? They are very important. We have to take weight. I mean, again, it's not weight, it's that visceral adiposity, it's that belly fat.
Yeah.
It's metabolically active. We have the tools, right? But we have to have this under good care.
One note in your book, you talk about a study out of Denmark where if you exercise after getting off of the medications, it helps you keep the weight off, you know, which you would guess, but there really is something you can do to prolong the impacts of these drugs. Dr. Kessler, thank you so much.
Yeah, thank you, appreciate it. Dr. LaPook, thank you as well. That book again, Diet, Drugs, and Dopamine, the new science of achieving a healthy weight. It is on sale today. Happy Publication Day.